Healthcare affects all Americans. We know that. It is a situation whether if you don't have health insurance or access to good quality health care, some people think, well, is there a crisis in America today? What this hearing is going to focus on is one of the best ways that we can control cost and, in fact, make health care available to a lot more people if you bring the cost down, and doing that through encouraging healthy behaviors. All three of our witnesses today have incredible personal stories as well as what they've done on a professional level, and we're excited about having them here today. We also have Steve Bird, the CEO of Safeway. He launched at his company a consumer-driven healthcare plan that I believe can act as a template for addressing our national healthcare crisis. Overall healthcare costs, I'll let him actually tell the stories on exactly how much money that they saved, but the bottom line, through rewarding people, putting financial incentives in, they were able to help or encourage people to make healthier choices, and they've been able to bring their healthcare costs down significally.
Steve Bird has already been introduced by Senator Ensign. I want to recognize that Senator Richard Burr has arrived. Senator Burr is one of the leaders in Republican and in the Senate in health policy. He introduced yesterday a major bill on health care reform, and we'll be going to him for comments and the first questions after Steve Bird. Steve, welcome. You've been talking both with Democratic and Republican senators for quite a while. We've all been very impressed. We appreciate the time you've taken to come all the way across the country to be here again. And we're getting to the point where I think all of us will be specifically interested in the provisions you think that ought to be in any legislation that will help eliminate the obstacles to permitting employers such as yourself to give incentives for wellness and prevention. So we look forward to your testimony. Thank you.
Okay, thank you very much, Senator. I too appreciate the opportunity to address the policy committee. I'm going to try to take the Safeway story, which I've told often, which I prefer to do in 45 minutes, and I'm going to collapse it to 5. Just as a basic set of numbers, everyone needs to understand that we're a pretty large organization with some 200,000 employees. Of those 200,000 employees, we have about 30,000 employees that would be non-union employees, and the balance would be union. The reason I make that separation is that what I'm going to talk about in terms of the progress that we've made on health care, it affects both populations. We've made more progress on the non-union side only because we don't have to wait for the next bargaining event to make that happen. I'm absolutely confident, given my conversations with the unions that represent Safeway's employees, that we'll make the same progress in those environments as well. It all started in 2005. In 2005, we had health care costs of roughly $1 billion, and they were increasing at a rate of 10% a year. So in 3 years' time, I would see a $300 million increase. We as an organization pride ourselves in our ability to look at issues and problems and see if we can solve them. And this to us was initially just a cost problem. We made a great discovery, which I think was little known at the time, may still be little known today. And that is that 70% of all healthcare costs are driven by people's personal behaviors. As a business guy, that was a large dose of good news, because it said if I could influence behaviors of 200,000 people, I could have a dramatic effect on their health and therefore our costs. The second major discovery, which the governor talked about earlier, the numbers are between 74 and 80%, but well recognized in that range, you have 4 chronic diseases which are consuming all these costs. And it's fascinating when you look at the chronic diseases, the #1 disease in terms of cost is cardiovascular disease. And yet 80% of cardiovascular disease is preventable. In other words, if we change our behaviors, we can prevent that from occurring. You've got cancer. The numbers range from 40 to 60% of all cancers are preventable through behavior change. Then you've got diabetes. With most diabetics being type 2, at least 80% of type 2 diabetics are preventable and in fact reversible. And then fourth, you've got the conditions of overweight and obesity, which really affect all of these. We've taken a very holistic approach to healthcare at Safeway. And in essence, we're building a culture of health and fitness. And I think the things that I want to talk about, which fit into that category of prevention and wellness, that are unique to us, will be of keen interest to the committee here. We've made dozens of changes over the last 4 years. Those changes have allowed us to keep our health care costs on a per capita basis absolutely flat, at a time when the rest of business and American industry is up 38%. We've done it by encouraging our employees to be healthier. Last year, we introduced a program that's called Healthy Measures. And under the current law, it's important that that be a voluntary program. 74% of our employees signed up for Healthy Measures. And right now, the 4 measures that we're focused on would be smoking. Second would be obesity. Third would be controlled cholesterol and controlled hypertension. So what we've done is we've structured incentives so that if you don't smoke, you have a lower premium in our company. If you are not obese, you have a lower premium. If you're, it's okay to have hypertension, but it must be controlled. In fact, 17% of the people that were measured discovered for the very first time that they had hypertension. And then cholesterol level, also people discovered that they had high cholesterol, so they could begin to do something about it. We provide, if you have family coverage, the total incentive granted to our employees is just under $1,600. The reason it's not more is the current HIPAA legislation, in conjunction with ADA, actually limits the incentives that you can provide. When you consider that a smoker costs about $1,400 a year annually to insure, that extra cost, our incentive is around $312. We'd much prefer it be closer to the cost of the behavior. Obesity, our incentive is about $312 for an individual. And again, obesity costs are estimated to be something north of $800. And so that's clearly an area where I think Congress can make some change. And you also need to make some change in ADA, because ADA works with HIPAA, and it further constrains what you can do in the workplace for incentives. I'm a firm believer that if you make changes on incentives, if you make changes on cost and quality transparency, provide electronic medical records, get some of the inefficiencies out of the system, that consistent with what Senator Ensign said in his opening remarks, you can finance health care for the 47 million uninsured out of the efficiencies in the system. And I consider behavior to be the fuel that really drives the engine of change here. The other thing that's unique about our program, if you have a BMI index of 36, which is considered obese, and you make 10% progress in the next 12 months, we write you a check to reimburse you for the premium difference you had at the start of the year. We do the same thing for smoking, cholesterol levels, and hypertension. It's my belief that 35 to 50% of our employees will line up at the refund window at the end of the year. And so we just firmly believe that it's important for the nation to, prevention and wellness is great, but to me that's high-level discussion. But we need to get it down to the level of behavior. Behavior really makes a difference. And as much as I would like to argue that we've been innovative, we've done nothing more than borrow from the business model of the automobile insurance industry, where driving behavior actually matters, and there's a difference in premium. We think that should hold true for healthcare. And there's no way to get healthcare costs down, I think we've all said it, without making Americans more healthy. And incentives do a good job of accomplishing that. Well, I think our proof rests with our numbers. The rest of industry is up 38%. Our costs on a per capita basis are flat. And that's not a cost shift from the employer to the employee. That's the all-in cost. That's their portion plus the employer's portion. I think what has made our program easier to implement, Governor, is that we're self-insured. And because we're self-insured, we're free to design our own plan. And we actually saw a 13% reduction in costs in the very first year. We've added a series of benefits that we think create better long-run cost control, and that's why we're only flat. Otherwise, our costs would be down. If we had cost and quality transparency, and I have some ideas on how we could capture that, I would tell you that we would take our costs down for another 5 or 6 years. If you look at our numbers and some of the detail, our obesity rate in our company is 70% of that of the nation. That suggests we're doing something right in the area of obesity. Our smoking rate is 70% of that of the rest of the nation. We have a feature in our healthcare plan, which, as far as I know, no one else does. It costs money. It's a feature called, I call it a cancer concierge service. If any one of Safeway's 200,000 employees are diagnosed with cancer, they call a hotline. We walk them through, in a hand-holding fashion, the diagnosis and treatment process. And if they would like, we connect them to a major cancer center in the United States. That buys good health. It buys great loyalty. So we don't have sort of the turnover statistics that maybe some other companies.
Mr. Byrd, if I could ask you, quite an undertaking by Safeway. I'm sure a lot of it was because it was the right thing to do. Could I ask you what percentage of it was because the healthcare model that you had was not sustainable and you were trying to put in place something that was sustainable financially into the future?
I mean, clearly that was the initial motivation, you know, this $100 million annual increase in cost. And so once we discovered that we had figured out a way to control healthcare costs, we thought we should share that with everybody else. I have told this story to more than 500 CEOs in this country. I've walked the halls of Congress, talked to more than 60% of the U.S. Senate, had conversations with the White House. I just believe so strongly in the benefits of doing this.
Mr. Byrd, could you elaborate more on what you had to do to put all of this information together, and also if you could maybe give the example that I heard you give on Lipitor, once again providing information to your employees.
Sure. I'll do the Lipitor example first. There are, you know, 11 or 12, maybe even more different cholesterol-lowering drugs that people can take. And as a branded drug, that was the most expensive. So one of the things we did was we just completely flipped our copay tables in our healthcare plan so that we knew what we would pay for a generic drug, and we altered the copay on the branded alternatives so that the copay on that particular drug today is $70 versus $5 for a generic. We sent a letter to all of our employees and said, you know, please consult with your doctor. We believe that in 85% of the cases, you know, a generic will work. And if we got a letter from their doctor that said they'd tried the generic and only this drug worked, then we would give them the same copay as we would for a generic. And so we did that across 13 different categories of drugs, and it had a major effect. We got dramatic switches to the generic drug, and always in consultation with the doctors. You know, I like to think of behavior as a form of currency, and the healthier behavior, the more currency you have, and that currency is used to buy down your medical costs. But there's predominantly, I think, if markets work, and in all free markets, costs go down and quality goes up. We can have that experience in healthcare.